Welcome back to 10 News Conference. My guest today in studio, the president and CEO of CARE New England, Dr. Michael Wagner, and the president and CEO of Brown University Health, John Fernandez. They've been on the show separately with me, but they're back now teaming up to talk about Rhode Island healthcare and hospitals and everything else that's in the news. Welcome back, gentlemen.
It's good to be here.
All right, let's begin with CARE New England. What hospitals are you responsible for?
Butler, Kent, and Women and Infants.
Butler, Kent, Women and Infants. That leaves?
Rhode Island Hospital,
the big one.
Hasbro Children's, Miriam, Newport, and Bradley Hospital, and then two new ones in Massachusetts, St. Anne's and Morton Hospital.
Right, and you came down from Boston to join us. You were on when you first came to Rhode Island.
Yeah, I followed him down.
That's right, you're right. You're both, well, I would say relatively new, but you're new to the last people we had in who went through the whole COVID thing.
Yes.
And now you're the new people running it. All right, well, very much in the news is reimbursements, doctors complaining. We have a healthcare crisis, so to speak. Anchor Medical is closing. Why don't you take it first?
Sure.
The governor says he's got a plan. The Attorney General threw cold water on it. What's your take on how to fix this?
So we definitely have a crisis in healthcare. When we look at not only Anchor, but go back 9 months. Thunder Mist, almost out of business, 6 days cash on hand. Rescued, still shaky in terms of where they're at. Village Medical Group, remember that? That was a group that was a bunch of physicians practiced, aggregated as Village. Walgreens bought them. They also announced they were going to come out of the state. Between those two practices, 110,000 people could have lost primary care 9 months ago. Nothing changed systemically at all in terms of reimbursement. So it's no surprise that Anchor came forward and said, we're not making it work. It's not going to work based on the current reimbursement. So there is crisis. On top of it, Prospect is coming out with charter care, not a clear path on how Fatima and Roger Williams are going to make it. They're going through their debt refinancing that will get them going again. But long term, they don't have a plan in terms of long-term sustainability. I don't know. I think that's a crisis.
You know, if we had another chair, we'd put those last two guys here, but we're with you. Over at Lifespan, you absorbed the coastal...
You mean Brown University Health.
Brown University Health,
You got to pay in the curse box.
This is Rhode Island. We'll be calling it that for a long, long time. We still refer to Almax. They've been gone for 20 years. Over at Brown University Health, I know you have the new sign up there. You guys absorbed Coastal Medical. So you run a group of doctors as well. And now this Anchor was a separate group that went out. Are they knocking on your door saying, let me in, I need a doc?
Yeah, they can knock on our door and we welcome them in. First, yes, we have lots of doctors. We have about 4,000 doctors in our group. So it's not just a hospital group. It takes doctors and hospitals to make healthcare work.
Well,
and so we welcome those doctors to join our practice. Happy to have them.
Okay.
And so would Mike probably.
All right, so those who are left.
Right.
Because the Anchor, they're going out, they're going under. A lot of those docs says, I can't make it in Rhode Island.
Right.
You know, I'm not getting enough money to stay and live in Rhode Island. I go next door, I could open a practice in Seekonk or Swansea, or I could open a practice in Stonington, Connecticut. You can still come and see me, and I'll get paid more because their reimbursement rates are more. Now, the governor says, well, I want to review everything and see what's what, separate fact from fiction. We'll give you the fact and give you the fiction when it comes to that.
So the fact is we have a bill we're supporting, House Bill 5790, that puts matching funds to get more money into the Medicaid system, which will help us up to about $270 million.
Okay.
That'll help a lot, both the hospitals and the doctors, especially in Medicaid, which is severely underpaid. So that's a big first step that we are pushing hard with the legislature and the governor.
Right.
It's going to take a lot of different steps, but that's a big first one.
Well, the governor says he wants a review to separate fact from fiction on all these complaints about reimbursement rates. I know a lot of doctors. I have dinner with them. That's the first thing they talk about.
Right.
They're not getting paid enough. So that's a fact. It's not fiction.
It is a fact. It is a fact. Rhode Island Foundation, did a study probably now a year and a half ago, clearly quantifying what your doctor friends are telling you. Reimbursement is less in the state of Rhode Island than it is in our adjacent states. So it clearly is an issue. We believe that there's been enough study. We actually think that we need to move to action and actually increase reimbursement. Medicaid with the federal match, as John just talked about, is the first step. It brings new dollars into the state. It's one of the few ways to actually bring dollars into the state from the feds to help reimbursement in the state.
Okay, so you're done with that part. You don't need to study it.
We don't.
You know that you're not being paid as much, and you know the
Correct.
doctors are right when they complain. Well, did you tell the governor you don't need to review this? It's a fact. He says he wants to have a big review of it. He wants funding to do that. So what? Let's go ahead. You can talk to him. He's listening. He watches us.
I'm sure he's listened.
Yeah.
We've been very clear. We think action is needed. That's why we put the bills in. We're focused on getting that approved. Look, the stuff he proposed, all good stuff.
Yeah.
But we need to move to action, and our bill, which we hope gets approved in this legislative session, is the most important thing, period, end of story.
Yeah, I know you probably don't want to get involved in politics between the governor and the attorney general, but let me ask you anyway, because the AG threw water on it. You said you were watching that story before you came on. Want to react to that?
I'll let them have their moment in the sunshine with that one. But we want them to support our bill.
Yeah.
Period, end of story.
Go ahead, and I'll give you the last word on that. We'll move on to other things.
I appreciate Peter's passion around supporting primary care. And as you know, he's married to a primary care physician who was my resident when I trained.
Okay.
So,
all right.
So, this is Rhode Island, right?
Yes, we all know each other here.
So he's passionate about primary care, and I appreciate his passion. I also agree that what the governor's put on the table is a good start. But there's stuff that we can be doing now in terms of reimbursement. I think more study is not necessary.
Okay. You said that any of these doctors from Anchor, if they're looking for a home, you'll provide it.
Yes.
That's the ones who are left. The real story is that thing is going out and under, and those doctors are leaving. I don't know if some of them are retiring, they're moving, whatever it is. 25,000 people are without a doctor. Can you open the door to the patients as easily as you would for the doctor? Go ahead.
Yes. We're working hard with our staff and several other primary care groups to find spots for those patients, especially the ones that need care now. Others just need somebody over time. And so we're working with people to do that. It's not easy. We already had a waiting list of about 10,000 people. So this just added to the problem. It's getting worse and worse. And I will tell you, they are the canary in the coal mine. There are 4 or 5 other groups we're well aware of that are either going to have to do massive layoffs, that's jobs in the state, or closing practices or reducing them. Mike articulated, we have a crisis. Hospitals, doctors, you name it, it's going down. And if we don't do something soon, there'll be consequences, less construction projects, less jobs, less revenue to the state. So to me, it's a pretty simple formula. Healthcare is a very good economic development tool for the state, the governor. And I think that's why the Attorney General brings some of that passion because of his wife, but also because he's spent a lot of time getting to know healthcare. And we appreciate everybody, including the speaker, who are working hard to see if we can find the money to do this. But it's too important not to solve now.
Now you have a group, you have Coastal Medically absorbed that, so I guess you could add more docs there if you have them and take the patients in. Can you help alleviate this?
I think one of the things that's important to recognize is that health systems increasingly are a major employer of physicians. So John has 4,000. We have another 800 physicians, 75 of which are primary care physicians. We've already accepted somewhere in the range of 700 or 800 patients from Anchor into our primary care practices. So we're doing our part to help those patients find a new primary care home. But we have to remember the ecosystem for physicians is complex. But it really is made up of doctors in independent practice, FQHCs, federally qualified health centers, places like Providence Community Health Center, Blackstone Valley, Thunder Mist, and the health systems. It's a really complex health care system, and reimbursement has to be thought of across the board in creating a more stable ecosystem.
All right, the doctors are in the house with us. We'll be right back to continue 10 News Conference, another segment. Stay with us.
Are you feeling stuck in your career or lacking employment at the moment? Experiencing symptoms of job dissatisfaction? You might be suffering from a common condition known as career stagnation. But don't worry, there's a solution. Monster.com. Monster.com offers a comprehensive suite of career-boosting tools designed just for you. Our free resume review and AI interview prep tool will help you stand out from the crowd. Need more guidance? Dive into our career advice articles for expert tips and insights. And don't forget to check out our salary tools to ensure you're getting paid what you're worth. Side effects may include a new job, increased confidence, and a brighter future. Consult Monster.com today and take the first step towards your new career. Ready for your next job opportunity? Visit Monster.com now.
Are you ready to unlock your creativity and transform your passion for beauty into a career? Southeastern College is here to help you take your first steps towards training for a career in cosmetology. Unlock your potential and start your path towards a career making people feel confident. It's time to invest in yourself. Visit sec.edu for more information on our programs and take the first step toward training for a brand new career in cosmetology. Your before and after story starts now at Southeastern College.
The hospital bosses are in, Dr. Wagner from Care New England, and I made you a doctor before. I don't know if you want to be that, but you said your term of degree is public administration.
Yeah.
All right, you're running Care New England, which is the larger of the two. But both of you, from time to time, I read in the paper, the nurses are unhappy. There's this labor action. They've approved a walkout, informational picket. Go ahead. This has happened to both of you.
Sure, yeah.
Care New England, go.
So we've had highly unionized. So, we have unions at all of our organizations. We've successfully gotten through a union negotiation, Kent with UNAP, successful at Women and Infants with SEIU. Butler is now in negotiations. We have gotten a strike notification for May 15th.
Yep.
We were working very hard at the table to come to closure, and we were working very hard to avoid any work action or any disruption in patient care. We also have some notifications of pickets that are occurring at Women and Infants and at the VNA. So a lot of labor activity. And John said earlier, this increases the amount of conflict that we have within the healthcare system because we are so constrained. We don't have a lot of money to be providing because we're in a very resource-constrained environment. So it leads to a lot more earnest conversations between us and the union, but we're working very hard to avoid any work action.
Well, it comes down to money.
It does come down to money.
You don't have it to pay. They demand it. They say they're worth it. Go ahead. Well, give me your labor report card.
Well, I just want to pick up on one thing. I think you hit on the key point. It's about the money. We tend to talk about this, that, and the other thing, but it's really about the money, no matter which subject you're coming down to, whether it's healthcare reform or our crisis and how to fix it. But on the union front, we are in negotiations with UNAP here in Rhode Island and then the Nurses Association in Massachusetts. Here in Rhode Island, we are still negotiating. We have a few pickets coming up in the next couple of weeks, but we have meetings to continue our negotiations over the next couple of weeks. We're hoping to reach a solution.
So your picket line could be next to yours up there in Providence, because your hospitals border each other.
We do not have a strike notice, which is a good thing.
Right. But, the COVID money's gone. Those were the days when the money was rolling in, COVID reimbursements, and they'd write down all kinds of things. What's your reflection on that? Where do you stand with your bottom line now at Care New England first?
So in the first 6 months of this fiscal year, which just ended at the end of March, we have a positive margin of about $4 million, which is far better than when I came in here almost 2 years ago when we chatted about our financial situation. So we are making a modest positive margin, not quite where we want to be from a budget perspective. So we're not quite there.
But those labor unions know that. I guess they want to eat into it. Is that the challenge you have?
I think no good deed goes unpunished, and the work we've done to create a more stable environment financially for Care New England, I think the unions appropriately are saying, some of that for us and the wages for our employees. That's a very legitimate ask on their part, and we are very much in sympathy with making sure our employees get paid so that we can compete against Massachusetts. So yes.
Let's go to Lifespan. Give me the same rundown. Your bottom line right now?
Bottom line right now, we first 6 months of the year we're plus 24 million. But we're about 26 million behind budget, so we're not quite making it. Last year we had a much better year, about 43 million, but that was half of our margin target, which is about $90 million. And when we don't meet our margin target, we can't afford to invest. And I think we have a fundamental problem that the healthcare organizations, and we're in the best position. Everybody else is doing worse. That is really, really bad for jobs and the economy of the state. And until we fix it, we got a serious problem, and we aren't even close.
Just about a minute left. What's dragging you down right now? The unreimbursed care? You provide a lot of care to people who don't pay you.
Exactly. Unreimbursed, under-reimbursed, Medicaid, all those things bring us down. It's a revenue problem, but I got to tell you, if you can't fix the revenue problem, then we have to reduce expenses. There will be jobs that will have to go away, programs that will have to go away, construction projects that will have to stop. So we got to fix this revenue problem. If we don't, then we have to start with the expenses.
I mentioned the COVID money. Do you wish you had some of that COVID money back? A lot of cash rolled in during that crisis. A lot of cash rolled out too.
Yeah.
I mean, did you go back and look at that and say, wow?
But it's not a sustainable way of running a healthcare system. Fundamentally, we don't get paid appropriately for the work we do every day.
Yeah.
I'd far rather that we actually figure out a way of paying sustainably as opposed to one-off or one-time reimbursements like the COVID money.
All right, just have about 30 seconds left. I'd like to have both of you back because there's so much we could talk about. You know, small state, 40 by 50. Do we have enough hospitals or do we have too many? Do you see a way to streamline this? Right, Westerly's there, Woonsocket's there, we're all in between. Just take about 10 seconds. Have you thought about that?
Thought about it, but you got other fish to fry besides worrying how many hospitals there are.
Fair enough. And you? Just 10 seconds.
You know, we have an appropriate number of hospitals, and if Roger Williams and Fatima closed, it would be a huge problem for the state.
All right, these are the hospital bosses. Thanks for coming in. Nice to get together with you again.
Yeah.
Appreciate it.
Great point.